Okay, let's start. Take one. Good afternoon, everyone. We're here, or actually, we're not in the same time zone, so it's good morning and afternoon. So I'm personally in Florida. It's 6:30 in the morning, and Dr. Florian Immekus, happy to have you on board. You are in Germany, and the time is, I think, 12:30 there, or is it?
12:30, yes.
Yes. Happy to have you on board, and really pleased to speak to you today, because you are one of the innovators in the field of utilizing 3D printing based technology, and you have some experiences from your hospital. And I wanted to just briefly talk about that. And you actually have just published an article about this, how you have implemented the technology. So could you just highlight that article and what you found, what the findings are in that article?
Yeah, of course. So thank you for having me, Niklas, and a great pleasure to work with you and your company since, I guess, 1.5 years now. And we tried to establish the 3D printing method in our clinics. So the environment is in University Hospital in Minden, right in the middle of Germany, where we also are responsible as a hospital pharmacy for the drug supply of about 2,500 hospital beds. And I guess nearly 100 of them are in the pediatric clinics. So, of course, we were very interested in pharmaceutical answers on the question, how could we personalize medicine? How can we personalize dosage forms? And yeah, from today's point of view, hospital pharmacies often work with traditional formulations like capsules or suspensions. And of course, that lacks certain quality aspects we are very interested in. For instance, we are not able to control the whole production process in a quality by design approach. And we have a lot of working steps which are such which have quite a huge manual aspects, and of course depend on the training of the staff we have there in this area. And we looked for a process which is highly validated, and this led us to your technology for the semi-solid tablets. And what we discussed with our pediatricians was which APIs would be very interesting for the technology, and we quite fastly came to furosemide, because there we try therapies with very smallly titrated dosages. And yeah, this was the project, and sounds quite simple, but then the regulatory framework in the EU and especially in Germany came over us. And as we are not a pharmaceutical company, we don't have this regulatory gegenpart, against part, like, for example, a pharmaceutical company. So this is very hard to discuss all these very detailed aspects with your local authority. And that was one of the main aspects of our project. Yeah, we were very happy that we could reach it and be one of the first hospital pharmacies in Germany who have a patient care program now with semi-solid tablets with furosemide, and further APIs will follow. Today, I guess we start with ibuprofen, then quetiapine, ondansetron. And yeah, when this barrier is one time achieved, then of course the further rollout is, I hope, easier now.
Yeah, that's great. Very nice work. And how would you describe how you work with the physicians there in your hospital, and how have they sort of taken this on board?
Yeah, that was, I guess, the easiest part, because to explain that our old-fashioned formulations like capsules and suspensions are not really looking into a good future concerning aspects of quality, that was easy. And so our physicians were very, very happy that we now come up with an alternative, and we're open-minded to test it. So first, of course, we tested with placebo, and of course asked the nurses, especially who apply these drugs to the children, how does it work? How are these manual aspects of administration? What could we do to make it easy for you? And afterwards, then we started with furosemide and the first API. So a very open-minded atmosphere, very close discussion, very solving problems orientated work. So.
Okay, great. That's great to hear, because you always need the right stakeholders, you know, the pharmacist and the physicians on board to implement new type of technology. So that's great to hear your experiences. How would you describe, like, if you just summarize? I mean, if we think about these type of technologies, you touched upon the points, I think, in your previous comment. But if you summarize, like, where you really see the benefits of bringing this type of technology now, unrolling it out even further, what are the main points? Let's say 4 or 5 main points.
Yeah. The first main point, in this pediatrician point of view, they are very concerned about how we handle industrial drugs today for this pediatric treatment. So we have to manipulate a lot. We have to smash tablets down. We have to solve them in solutions hopefully are feasible for this kind of preparation. And yeah, there are a lot of things which, of course, can just concern someone who is very competent in using drugs. So this is the main aspect, to get rid of these manipulations. The second aspect, I think, is the personalization of medicine in the greater picture. So of course we learn a lot about pharmacokinetics of individuals. We learn a lot that our patients are not that homogeneously fashioned. They are very individual, and of course in certain situations, like you find in intensive or intermediate care stations or ICUs, there of course patients need very, very tailored drug therapy. And today this is hard to handle. Of course, in intravenous systems, you can have a very individual dosing. But in an oral therapy, this is not that possible. And this is also economic effects we are very interested in, because just think about a patient has to leave the hospital, and he just does not leave the hospital and costs a lot of money, because the physicians are not convinced that the oral therapy works out in an out-hospital setting. And this is, of course, thinking about pediatric patients, and of course language barriers to the parents, to explain them, okay, just take 2 milliliters of this syrup. And yeah, it does not work out. The children stay in the hospital for 1, 2, 3 days, and this is of course a lot of thousands of euros. So it has a very economic aspect. And in our following project, we will figure this a little bit more detailed out, because I'm very convinced that we have there a lot of economic potential besides the quality aspect, which is doubtless.
Yeah. Okay. Thank you very much. Very, very insightful points. And I think we've covered quite a bit of topics here. So thank you so much for joining the Medicine Maker podcast or video. And